that option away from me.
We should be good now, yeah?
Yep, it's now coming up. It shows it's being live streamed. I got that.
Is the audio streaming as well?
I'm just checking right now. I'm going to log into TikTok and everything. Okay, here we go. You see it on TikTok, Justin?
I'm looking.
Okay.
Kind of waiting to see. See, I put it on my story and told people that I was joining this, but I don't see it yet.
Okay. Just waiting for it to go. Might take a second. So we have 8 minutes.
No, I don't see us live on TikTok. Do you guys?
It took a few minutes last night, so let me see.
No, it's live on LinkedIn, BES page.
Mm-hmm.
I should have totally put it to my personal page. I forgot I have more followers.
Apparently this Joey's just waiting for TikTok. It's funny because TikTok was the first one to come up both times we sent it last night. Oh, so might just be lagging. 7 minutes.
Anybody see it on TikTok yet?
I'm just refreshing right now.
Was that a yes? Sorry.
Not yet.
Not yet.
I don't see it yet. Sometimes it might, if it works, it's... Last time it worked randomly yesterday.
Anybody see it on TikTok yet?
So you guys are live.
Yeah.
Yep. We're live now.
Right.
Was that a yes? Sorry.
Not yet.
See it yet. Sometimes it might, if it works, it's...
I'm just waiting for TikTok to come up. Everything else looks good.
So Facebook, LinkedIn. I know Instagram didn't go up yesterday. Let me check Restream to see if something went. I need to set a stream code again or something.
Yeah, TikTok was the first one to pop up last night.
Yeah, it should be. I don't know why it's not on.
It says live streaming right now, so I'm looking here. One exception.
Yeah, it's not hitting. Okay. How to apply. No, I did it yesterday. Oh wow, it suspended the access yesterday.
Okay.
I'm not sure why. It says couldn't apply because your live access is suspended.
Oh.
What?
That sucks.
See if I can share this URL to my story then. Let's see. Yeah, sometimes TikTok they be strict on so many random things.
Finicky. I hear somebody munching.
Yes.
It's Johnny.
Oh, Johnny. Oh. It's hungry.
Yeah, let's see. So this is
why people were complaining about their TikTok streaming problems. This is probably part of that too, I would guess.
need to get the URL to share. I think it's this one right here.
I'm gonna go back, check this again.
I might be able to put it on my other TikTok though.
So, I mean, we're live on LinkedIn right now, so that worked. We're okay. It's just not on TikTok for some reason.
No, it's suspended it. I don't know why. Out of luck.
You guys are streaming on YouTube though, right?
YouTube is streaming, yeah, on the Musings channel.
Okay, cool. I'll send that URL to
I just checked LinkedIn. We are live.
Okay,
There.
cool.
Yes, we are live there. I just shared the link.
Great.
And I don't know if you guys saw what's going on with Raja, but that blew up the interview I did with him.
Yeah. I saw it was like almost 1.2 million views we've got just on that one as of like a few hours ago, I think.
Yeah, it's like 1.3 right now.
Yeah. Big story.
Yeah.
So 3 minutes out.
Okay, hold on. Let me post
TikTok.
this.
See live.
Wait, why can't I put the link in here? Paste.
2 minutes. Hopefully TikTok will catch up.
You guys see the message David just sent me? I don't want to say it on there. He's trying to get on right now, though.
Okay. We're 1 minute out. And once we start, we'll also be recording.
Is it okay if I have the camera off or it has to be on?
No,
Leave
keep
it
it
on
on.
if you can, please.
Yeah. Nobody's going to see you. It's not...
So we just need Marc. There he is. Okay. So I'm watching as a viewer on my other computer. So I'll be muting. Got 1 minute. So I'll let you know when I go live. You'll hear it say it's recording.
You like that, Marc?
Huh?
You like that, what I sent you?
Yep.
That's a first, huh? Coming back, not going down. I guess that's yeah, that's what you do, right?
Okay, we're on. We're going to go live now.
Good evening, everybody. I want to take a look at our participants and just see who's filling up. We've got some attendees joining us. Looks like a lot of DES folks, Dialysis Education Services folks. Want to give a few more minutes. Guys, make sure you're sending this out to any friends and family, colleagues that are in the healthcare space, anybody that you know that's suffering from chronic kidney disease. This is the last of our 5-part CE webinar series. I'm very happy to have a kind of a reunion of old and new friends. I'm not sure if you all can see the gallery yet, but we've got a great lineup of folks in here that really care about keeping people healthy, caring for those that are vulnerable, and empowering through sharing stories. So as to the theme, let's just kick it off. Our theme for this webinar series has been tightening the safety net, closing cracks in care, and perhaps the most important voices in care are those that are receiving it or in need of it. So the title for tonight's webinar is, what do the patients say about cracks in care? And I think in some of the conversations we've had, let's just say, you know, what do people say about cracks in care? These are not just patients, these are great friends, brothers and sisters that I have with us tonight. I'm looking forward to giving some introductions. But this is, again, perhaps one of the most important webinar sessions that we have had in the last 5 weeks, and really one of the most important sessions that I've ever done. It's the first time that I've been a part of moderating a panel, and I have a co-host tonight that, if you can see the gallery, you can see Veronica Baiz in the house, Chief Operating Officer of Herewith, who has really lent their great heart and their purpose of care to co-sponsor the webinar series. She's going to be helping me to co-moderate the evening tonight. We have a panel that I'll let them give their own introductions in a few minutes here. But Johny Long, Justin Pham, Walid Hamdard, and Marc Coronel that know more about kidney disease firsthand than anybody else on this call, and probably most people that are listening in. So again, take the time now, send out the link that you use to sign into this. If you're streaming or if you're looking at us through social media, make sure that you check in and look for the link in our social postings for the Zoom webinar session, because if you are looking for continuing education to renew your license or certification, this is some free credit tonight. We got 2 hours of information coming from the people who have lived it. Can we switch to the next slide, please? I'll do a little bit of housekeeping as usual. Dialysis Education Services, one of the co-hosts, title hosts for the webinar series, is a continuing education provider in the state of California, which really translates to across the country. It's approved continuing education through the Board of Registered Nurses. And we also provide rudimentary education for dialysis technicians and nurses. I think right now, as I look at the Zoom link, everybody on the call is either students or network of Dialysis Education Services. You've got to stay logged into this webinar for at least 50 minutes to get any CE credit. 50 minutes equals an hour. So we're going to be here for 2 hours. You got up to 2 hours of continuing education, again, free, thanks to our co-sponsor Herewith and Veronica Baiz. We are going to be sending out an end of webinar survey. Melissa, I'm not sure if we've got any polls for tonight, but if you see any polls pop up during the webinar, please make sure to participate, give us some feedback, and then give us about a business week, to send out via email the continuing education units. If you're joining us from Zoom and looking for those CE hours, please make sure that you're signed in from your actual email and that your name is going to be visible, because this is tracked through Zoom. We can track how long you've been on, what your name is, what your email is, and for us to send out the credits, we need that information. It's going to get very confusing if you're signed in from something that's not associated with your email. Remember that continuing education is your responsibility if you're a healthcare professional. It's nobody else's responsibility. It's up to you to find it. It's up for you to log it, and it's up for you to provide it when you go for license or certification renewals. So let's dive into it. Thanks everybody for joining us tonight. Again, the most important discussion that we're going to have in this webinar series. We're privileged to hear from these 4 individuals that I call friends, and at this point, give me a thumbs up if I can call you brother, guys, because I feel that way about all of you. It's been for some of us a short road, and I love that, Veronica. There's a family. To just give a kind of high level of how I met most of these folks. Some of them were students of Dialysis Education Services, and they have a unique story to tell, not just about their education to become dialysis professionals, but also their personal experiences in the space. And others I met through social media and through different sort of LinkedIn, and I was like, man, these guys are really fighting the fight, and not just fighting the fight for themselves, but fighting it for the entire community of people who are undergoing this long and treacherous journey, hoping to help people to live their best life despite the challenges that kidney disease brings. So our focus today with these 4 individuals and my co-host Veronica is to really uncover the gaps from the other side of the care, those that are receiving the care. And that's going to help all of us who are healthcare professionals and all of us who are navigating our own health journeys to know what to look for, to know how to help, to know what to ask, to know where to kind of anticipate delays or gaps in some cases. So I want to turn it over. Veronica Baiz, if you'd open up your mic, I just want to thank you so much for being such an advocate for health, for kidney disease itself. And tell us a little bit about yourself, Veronica.
Yeah, well, thank you first off, Michael, for having me. And then thank you to everyone here for going through your journeys, which led us all to come together. I wish it was under, other circumstances that we could meet, but I think everybody here can make a powerful statement. So my name's Veronica Baiz. Michael is probably one of the only people who says my last name correctly. So thank you for that. I met Michael actually through Kimberly Langford, who is a nurse who I met at one of the dialysis conferences in Vegas. And it happens that she lives a few blocks from me at home. So it was a really nice connection, and just, it is such a small world. And I think we, forget that sometimes, but we're all so intertwined. I am the COO of Herewith. Herewith is really a technology platform that matches helpers, which are our caregivers, and that's their branded term, with families in every facet of care that's needed. And we have, the plethora ranging from senior care, which was our first, I would say that's our OG, and how our platform began and developed was really this Uberization of a Bumble type platform for seniors to be able to pick the caregivers that they would like the most, right? We then began to realize, as you will, that technology is really needed in the healthcare sector, and having something so powerful at the touch of a button, such as being able to get a care partner or a staff assist, or somebody who can go in and provide respite, is such a big need in this community. And so that's how we ended up here with Michael. And so that's a little bit about me. And then I think for our actual people here for the CE, for me, I would just encourage everyone to listen with an open mind. And of course, I think everybody here already has an open heart. And so sometimes we just have to put aside any pre-bias we have. Our panelists are going to share their lived experiences to really help push that conversation forward in improving kidney care. We'll have time, of course, for the audience to answer questions, or to ask questions, excuse me, and to really, even if there's something that they would just like to share, something that really resonates with you, please jot your questions down, or even just thoughts that you have as our panelists go through and are leading the way in this discussion. So I think that I will start passing off what Michael gave me with brief introductions. I'm just going to go to the right, if that's okay on my Zoom. I will start with Mr. Pham. You are to my right. But yeah, there you
Yes,
go.
thank you. Thank you, Veronica. So my name is Justin. I'm 33 years old. I've been doing dialysis, PD dialysis to be exact, for about 3 years ongoing. I've been currently been doing that for some years, and trying to be a awareness for kidney failure, and trying to get on the transplant, and willing to share my story, and kind of give a lot of insights on what it's like to be on PD, what the lifestyle is like around it, how to be on it, how to kind of really stay active and positive about everything. And I would love to kind of, if anyone has any questions about how to live your life comparing from PD to hemo, I've done both. And we'll continue probably to do PD until transplant, unless I have to go to hemo. So, those are a little bit about my experiences. But yeah, that's a little about my story.
Thank you, Justin. I appreciate that. And then how long have you been in the dialysis world?
Personally 3 years, but I've also had kidney surgery since I was a kid. So around 9 is when I kind of first started my journey with kidney, but I didn't really get into it until I got older.
Thank you for sharing. Mr. Long, how about you?
Good evening, everyone. I'm Johny Long. Thank you for having me on this panel. Great group of people, a lot of personal experience and stuff like that to listen to and to absorb. So I've been on dialysis for a little over 1.5 years, in center at this point. It just hit me out of nowhere. So I was really confused, and that's stuff I'm going to talk about later too, how to navigate through that, how I navigate through that. But it led me to a nice group of people here outside of dialysis, and it just broadened my horizon about healthcare. So that's
Great.
just,
Johnny, I appreciate you sharing. And then I don't want to make the last name wrong, but Walid, we'll move over to you. You'll have to tell me, how do you pronounce your last name?
Hey, hey, my name is Walid and the last name is Hamdard.
Hamdard. Okay, great. I will get it
Yeah,
wrong.
yeah, once again, it's such an honor to be back here with Michael Morales, and I've been with him online and live and all of these stuff for at least 3 times now. And so my full name is Walid Hamdard. I'm from Afghanistan, and I've been dealing with kidney issue since 2019. I've been on peritoneal PD dialysis and also hemodialysis, and I moved on to a great thing that happened in my life. That was a kidney transplant. And then I signed up for a chimerism. So I can't wait to share my story as a patient, as a technician, and also as a chimerism patient. So that's such a short introduction, and then we'll move on from there.
Thank you so much for sharing. That's pretty powerful. You've seen the whole continuum there, so that's great. And congratulations on your transplant. That's
Thank you
amazing.
so much.
Yes, of course. All right. We have Marc. You're on my right.
Thank you so much, Veronica. How you guys doing? My name's Marc Coronel. I'm a kidney transplant patient, was diagnosed at 26, ended up on dialysis at around 30, and have been really advocating for patients to share their voice. But my journey started at 26 on a routine physical. Can't wait to explain how that journey has been, how it's going. But through the process, I think collectively here as a cohort, we have so much experience where you can learn from the patient's perspective to understand when you guys are taking care of those patients. This is our day-to-day life. So I want to thank you guys for having us on and sharing our stories so that we can share that patient's point of view.
Thanks,
Thank you
Marc.
so much for that. Oh, sorry, Michael.
No, we're gonna be back and forth all evening, Veronica. Again, thank you for co-hosting and co-moderating with me. It's really an honor to be on with such a special person like you. It's been a short time, but I really appreciate your heart and the intellectual way that you go about applying that heart through technology, through real solutions for people to find the best fit for them. So, I want to just go right
Really
back to
quickly,
Marc.
Michael, I wanted to give a really quick shout out to Melissa. We can't forget her. I know her video is off because she's the magic behind all of this. And so
Wheels
I
of
know that
Steel.
she's hiding back there, but I just definitely have to give a shout out to Melissa because a lot of this would not be possible. I was just telling Michael, like, I need a Melissa in my pocket too.
Yeah, so just so everybody
yeah.
knows, I told Veronica, no, don't even start. Like, you'll take away everything from inside of this head, because Melissa's my brain, and we have some other team members at DS that really keep this thing attached to my body. I want to thank you as well, Melissa. This has been a great series, and this one specifically is, very special to my heart. As I said, I consider everybody here family. But I want to go back to Marc because just to kind of maybe you can share with the audience. Do you know these gentlemen that are on the webinar with you?
Oh, yeah. So, interesting story how we all met was Morales. I met you on social media. So that's now the platform that people are getting to get introduced to each other. And what was really interesting is that's how I got my kidney transplant, right? Through using social media to getting that kidney. But then I started to meet people like Walid, Justin, and Johnny from you, Michael. And it's such an honor to be able to be that lead individual who brings patients together, if that makes any sense, right?
Yeah.
I met Justin, and it was like, man, can I see your journey? And then he became we went to a what was this art gallery, and I was just so amazed by his day-to-day life being photographed, right?
Yep.
And in Walid, something very, very interesting about me and Walid is we got transplanted at the same center. He also came from the boxing world as well. where we had mutual understanding of the fight and grit and the the drive to pushing for that championship kidney. Look, we couldn't get a kidney transplant. We couldn't get a a WBC belt, but we did get a kidney transplant belt, right? And that's really, really admirable to see other people who are in the fight not giving up. And Johny as well. I met him at the art gallery. Amazing story, man. And now hearing them going on to the clinical side and being techs and working in the dialysis world, that's just a hands down thank you so much. Because while I was on dialysis, I didn't think that many people understood what I was going through, that they went into just doing a job. But there are actually people here that I've met through you, Michael, that are actually saying, look, I'm going through it, but I'm also giving back to the same community that is also helping me out, right? Phenomenal. So thank you guys so much for everything you guys do.
Yeah, if I don't know if there's a hand clap on Zoom or not, but I applaud everybody here for the way you've shared your stories with each other, and just looking forward that now this is amplifying. Have met many people through you all as well, and people brought us together, Veronica. So this community is growing and starting to mesh between, you know, the us and them type of thing, to where it's really it's all of us in this together, right? So let me get a question in here, and then I'll pass it back to you, Veronica. You know, reflecting to the current, do you feel like there have been times where the healthcare system, your providers, your clinicians in the clinic, that, you know, they have maybe failed or kind of missed the cracks, not been able to iron it out and close it up? Were there failures in your care, in your workup? And then are there ways that you think, or methods that you would advise to prevent those sort of failures for others in the future, whether it be your healthcare system, your healthcare team, or even in your personal knowledge? Let's start with you, Walid.
So actually, when I was doing hemodialysis, I was a patient at the UC Care, and from what I remember, I had a great team, and luckily I've never had any problem with them, and they were doing everything they could. So the only problem I had was their timing, the schedule. I always wanted to be the first shift, and then sometimes, they put you like, as a new patient, they try to, fit you in, and they kind of, they had me at the last shift. So their last shift was from 1 p.m. to, basically, if you go at 1 p.m., you have like until 5 p.m. you'll be done with everything. So that was one of the main issues that I was having with them. I actually requested if they could fix that timing as a patient for me. But as a technician, from the technicians, I've never had any problem. I didn't have any issue with transportation as I was driving myself up there. So luckily, yeah, I was actually in good hands, and I did not face any problems. And so as a patient, I've never had any problem with them. The only time I had problem was the schedule, because as a patient, I wanted to work at the same time being on dialysis, and I wanted to, I had to provide for the family as well. So when you have your middle of the day, in the treatment, it will be very hard to work at the same time.
Interrupts that.
Exactly, yeah. So you basically, I had two options. I have to go to work early morning until, get home and get done with everything by noon, or wait until 5 once I'm done and work all night. So that was the main problem for me, and that was a challenge. So yeah, thanks to the team, and they were able to take care of me. And they eventually put me into the first shift, which was at 4 a.m.
So you know, when you say the schedule and kind of what it interrupted, we quite often don't think that the interruption in life is a healthcare issue. It's like a convenience or a social issue, right? But when you did have that interruption, how did it affect you clinically? Did it have any effect on the actual outcomes, your ability to, and I hate using the word, so I'm not going to use the word, let's say adhere or follow the plan of care? Did it have any impact there?
Yeah, it totally had, because at the beginning I was actually trying to skip work, but at one point I was like, no, I have to work, and
Mhm.
so I was cutting off my treatments. I was not getting full treatments, so
Uh-huh.
yeah, I was cutting off one, and they have those AMA papers where you decline to get treatment, and then they make you sign that, and then that kind of used to worry me, like, you know what, maybe I'm making a mistake.
Yeah.
So at the same time, I was thinking about work. I have to go to work and this and that. So yeah, it was actually directly affecting my health as well.
Yeah. Thanks, Walid.
I've got
Johnny,
a question for him, Michael, real quick.
shoot.
So you're saying, you had to go in the clinic and it was disturbing your work. How often, or did anybody talk to you about the home hemodialysis?
So before becoming a hemodialysis patient, I was offered the PD option by my doctor. So I actually did PD for a few weeks. I would say maybe like 3 weeks. I don't know. So can you guys hear me? I don't know if there's
Yeah, we can hear you. It's up
Oh, we
Okay.
low.
can hear you.
Yeah. So yeah, I was offered PD option by my doctors and physicians, and I did go with that option at the beginning, but unfortunately, that didn't work for me. It was actually causing me a lot of pain, and it was disturbing my sleep, because usually patients that go with the PD options, they prefer staying on machine at night during their sleep time, and then get up, go to work, or continue their normal life. So unfortunately, that didn't work for me. And I was also, at the same time, I had a live donor, and my doctor said, you know what, we will stick to the catheter, because I don't want you to get a fistula, because you have a donor. Maximum, it might take you around 6 months to get transplant, but that didn't happen. It almost took roughly 3 years. So yeah, so they did give me the options, Hemo and PD. PD didn't work. At the end, I had to go, but for this fistula option. And
Yeah.
for PD, they had to, do the surgery again and again, twice, but the pain wasn't going away. So that was not a good option for me. It didn't work for me. So I did try PD for quite a little bit.
Great. Thank
Sure.
you.
You're welcome.
Johnny, let's go with you. Any perceived failures? And let me just open up that question a little bit, not just with your dialysis journey, but maybe before your dialysis journey. I know you said that it kind of hit you head on, it was very unexpected. So anything before, during, or current that you feel was a failure, and what do you think could have prevented or been done better?
Yeah, so everything started with me during vaccination, COVID, where everything was just crazy.
Mhm.
Hospital rooms just filled up, and I was just waiting to get a room and just waiting for hours and hours. I understand the COVID and one person, one patient per room, but it was so busy that I was misdiagnosed. I felt like I was misdiagnosed. So the handoff wasn't great with doctors. I had to ask questions over and over. Why are they doing this? Why are they doing that? So it was just like, to me, it was poor communication and misdiagnosing. So it kept on. It was a chain reaction after that. But once that kind of settled down and I had a complete care team, it was more effective. So it's always been an issue with communication, even with my primary care and my transplant care team. So they're always asking certain questions. I have to list out everything, repeat everything. My wife and I have a booklet of stuff that we gone through. So, and she's my backbone of everything. So she's like my
Hey, Karen.
recorder.
I said hi.
I will. But other than that, it's been great lately. I haven't had
That's
any
good to hear.
issues. So besides, prescription prices and stuff like that, but just like gas price, you're gonna have to pay for it. So
You mentioned the notebook and the questions, the reiteration. Do you feel like should we be patting your wife on the back, patting you on the back, because it sounds like you're becoming a stronger advocate for self, and you recognize there's communication. That's a big part of the gap. Is you mentioned the handoff, right? And I'm not big on sports today, but I know when I was into sports that when a ball moves from one person to the other, it's the most vulnerable time in the game. So do you feel like that's been a big part of things being better today, or is it just the team kind of doing this on their own? When I say the team, the healthcare side of the team.
they've gotten better because it's not as hectic as it was during the COVID time. So I guess there's more time to interact and have that handoff instead of just here's a couple bullet points. This patient has this. I got my gallbladder removed for no reason.
Oh, God.
So it was one of those deals.
Let's
It's
move over to
still-
you, Marc. Same question.
I'm so sorry, but Johnny, I second a lot of the things you've said today, by the way. But can we repeat that question? I was so involved in Johnny's answer.
Yeah.
I was just
Sure.
like,
No problem. So perceptions or realities of failures from the team, from the system, from individuals, and we're going to keep expanding on this question, even oneself, perhaps. I can speak to, and a lot of us can probably speak to this, the machismo, right? In some cases, like, I got a pain, I feel this way, and maybe I wait in some cases. Any failures that you can identify in your journey and things that could be done better, or that you would advise in closing up a gap for other people?
yeah, great question. Let me think this through really strategically, because I want to make sure everyone understands this full journey and process. When we're first diagnosed, right? We get a diagnosis either through a biopsy, and they'll tell you what kind of kidney disease you have based on your creatinine levels going up or down, your BUN, your all these phosphorus and all this stuff. I didn't really know anything about that prior to getting into what I know now, right? And this is just me advocating as a patient, just being able to learn how to really navigate my own healthcare, because no one's going to do it better than I can. Does that make sense? So when I was diagnosed on my 26th birthday, I remember very vividly, it was my 26th birthday's gift to myself. I didn't know what the next 8 years would look like, because I would hear something from the doctor, I would Google it and think I would die the next day. This was just my experience, right? It was just, what does this mean? What is this saying? Because of the lack of proper education, number one, and the lack of education that was given to me, and the lack of education that I was taught about healthcare, if that makes any sense. So I didn't come in saying I know everything about kidneys, or I'm going to know about the patient bill of rights and insurance or anything like that. I think it's something that you navigate and you learn along the way, right? What's interesting about this journey, I learned the difference between school and life is that school will give you a lesson and then a test. With this kidney stuff in life, they give you a test and then a lesson, right? So it was always a test where I had to learn something navigating this system. And it goes in three parts. Your diagnosis stage, you meet with a community that says, well, this is what's happening to me. Then you go into a dialysis phase where it's like, this is what's now happening for me. Because when I ended up on dialysis, what wasn't told to me was they told me you have to limit your intake to, I think, 16 to 32 ounces of water a day. I didn't learn that in the very beginning till I started hanging around other dialysis patients to navigate that, right? It's just this is what you're going to learn about dialysis. This is now what your new journey is. You're going to be stuck on it 3.5 hours each time, Monday, Wednesday, Friday. And as patients, you don't realize that it becomes your full-time job. And Walid much respects to you, brother. You had 2 jobs here, right? You had a morning shift, which was dialysis with 2 hours recovery, and then you went into your regular job. And I think as patients, when we go through this navigation of learning dialysis treatments, one of the hardest things for me was I going to be able to work out again, especially because I had a catheter to my chest, right? I wanted to work out. But the transition was more so emotional pain, because once I started to now understand my rare disease, which only 50,000 people, I believe, is diagnosed with focal segmental glomerulosclerosis. I really thought I was going to die when I heard those words, by the way, FSGS. I can now understand and say, you know what? I understand my own body and know how to advocate for myself, because if new medications are to come in, it's what do you see different? Because every healthcare provider I went through started giving me different medications. So the people that I did go to was I had to make sure that I trusted specific team members that I wanted within my group, because one doctor would treat me one way, another would say another, right? So I put a lot of trust with the team that I had that I built now, to say, all right, is this the way we're going to go? And I found success in the rate of how my creatinine levels are now working, right? The transplant journey. I think at that point when I went through that phase, and for those of you guys who are just tuning in, I used social media and had 33 people possibly be potential donors to come forward just by sharing a story and maximizing the hardship of what we go through. I wasn't able to urinate. I have to take phosphorus pills because if I don't, I'll start itching every time, right? I know a lot of you guys know what that feels like, where we have to take phosphorus binders, even if we're just trying to if we want to take a chip, like a potato chip, because we'll start itching and I can feel that, right? Our labs are done every day, all the time. I believe once a week on dialysis. So I was able to talk to my care team about, look, if my phosphorus levels are high, why did I do that? Because my end goal was I want to get transplanted. And by any means necessary, that's my next opponent. That's who I'm going to go fighting against, because kidney disease won the first round, but I got to make sure that when I get this transplant, I win that last round, right? So were there cracks? I think proper education needs to be understood, right? I think because I did have people who were my race and understood what I was going through, can tell me in our native tongue to say, this is what you're going through. This is what's happening. This is how the things that you can start asking questions towards. But the average person who does go in, I mean, we're looking at a full demographic of, let's just go on data, African Americans, Latinos, even Asians alike, who are on dialysis, who don't and can't comprehend what a tech or a nurse is saying, can find it really, really hard. Does that make sense? Because they don't know how to answer the questions, and it puts them in a rate of, okay, so it's just Monday, Wednesday, Friday. What do I need to do now? So as far as the cracks go, it's educating patients more on what they need to know instead of using medical jargon, right? I knew what hypertensive was, but what if it goes into the diabetic ketoacidosis, where now there's so many different terms put together and patients don't know what that means, and they're Googling it and saying, oh my God, something might happen to me. So the cracks for me would be the educational components. Very, very, very important. This took 13 years, 14 years to learn, just to sit at the table. And even then, I was still considered a data and couldn't be placed with a face to that data, if that makes any sense, right?
100% it does, yeah.
100%. So that was my hurdle, was just getting the education. I knew my kidneys were failing. They told me that at 26. It's just now, how can we manage it so I can create a team that I can trust? Again, I went through several different nephrologists. You know, some didn't fit my personality, and I knew, you know, for the patients who are listening to this, you don't have to be with that doctor if it's a referral. You can keep searching for one. Yeah, I can keep going. I mean, sorry, I want to give Justin,
Thanks.
I want to give,
Thanks, Marc. Yeah, let's look at like maybe 3-4 minutes each answer. We're going to be asking the entire panel. Justin, same question. Cracks in your care, in your workup, and advice on how to close them up.
Yeah, it seems like everyone has a different story. And, when it comes to news like this, everyone has a different reaction. And, for me, I was kind of just oblivious to the whole thing a little bit. I knew I uh, had a past with kidneys when I was a kid. So I kind of knew that it was coming, when I had the diagnosis. When I first got into the ER, they said, hey, you know what, your kidneys just failed. But I kind of took it as a shock in a weird way. I kind of didn't really believe it. And, with my experience, I think I took it pretty well. Everyone's story is a little different. And as everyone was saying, everyone's journey was, however they took it. But, for me, I actually really appreciated the hospital I went to. I was diagnosed in downtown LA, and they really played it pretty easy for me. There was a lot of people. I had a doctor, nephrologist that come in there in the ER and told me, what was going on, what they saw, what they believe what happened to me. And so, they kind of gave me the options of PD and hemo, and they were pretty straightforward. They were really telling me what dialysis there were and out there. I didn't even know what dialysis was to begin with. So a lot of it is just a lot of information at one time, especially when you know nothing about dialysis. And especially when they're telling you, you need to put this in your chest, you need to possibly put this graft in your arm, or you might have to put this catheter in your stomach. A lot of that is crazy news, especially at, someone that's young. All of us are pretty young. And so you don't really think that's going to happen to you. So it's all about taking all that information at once and accepting it. I think for me, I can't really complain how it was brought to me. I know a lot of people said this, it's just a lot of information at once, especially when it's your health, it's scary. And, a lot of people in hemo are pretty, when I was there, one of my only complaints about hemo was that, it's almost like a negative energy when you walk in there and you hear the beep beep. Like even to this day, I have PTSD when I watch videos on TikTok when someone's doing hemo, and then I hear all the background noises and the beeping, and like there's just so many, so much going on at once, and we're all young and you got jobs, you're trying to make money, and you have to fill in this health stuff. It's a lot of information. So I feel like the cracks is just being able to play the story and giving out the information all at the right time. I feel like when you info dump on someone, especially when they're still in shock, sometimes maybe they can kind of like play the information a little bit better instead of kind of dumping everything at once. But I don't want to complain about my story, but I feel like if anything I was to complain, it was just a lot at once, and the timing was just so much.
Yeah, no, the great points. And just, see some people in the chat kind of pointing out that over the last 5 weeks, we've talked about things like quality and safety, and the strongest theme that we're seeing week after week from all the speakers we had is that communication and education are the biggest gaps, or at least the most pronounced gaps at this point. So thank you for sharing that, guys. I'm going to turn it over to Veronica for the next question.
Perfect. So I think that for those who have transitioned, and this can be, I think we've heard a little bit right now from some of you who've gone from PD to HD. Maybe you've even done the home side of those. But my question right now is for those of you who have transitioned between the modalities, if you've received a transplant, what were those specific cracks or barriers that you encountered during those transitions? And really think to that actual transition itself, not just the full circle, because I think we hit a lot on kind of what our cracks in care are for the full circle of it. But, when you're going from one modality to the next, what do you feel those cracks were? And you feel free to, whoever wants to start that off. I know that, Walid, you have gone through the entire circle there, from having everything from PD, you said, to HD to your transplant. So can you speak to some of that? And then whoever else has had those different transitions, it's great to hear from too.
Yeah, actually, this is one of my favorite questions. I would love to answer this. So when I was getting those, they do those all the tests. Each hospital, they make sure the patient is in a very good shape before the transplant. So the hospital that I was getting my kidney transplant, So they were taking too long per test. So I could get my kidney transplant in a year since my donor was ready, but they sometimes they would tell me like, oh, it looks like you have brain tumor without any proper diagnostics or anything. Oh, it looks like you have breast cancer. So looks like you have one of your heart walls not working. So they just tell you like that, but they never think what patients think. Like it fears the hell out of the patient. We are already
Yeah,
dealing with kidney
shocking.
failure, and then they tell you, oh, looks like you have brain tumor, and then it takes another 3 months. It delays the entire process, 3 months, to just find out what's going on in my brain. And it turns out to be, oh, that was a false alert.
Mm.
And the
So it
next,
seems almost a little bit, just to classify it or I guess quantify that, is maybe a little bit of bedside manner and diagnostics. If there's something that might be alarming, get a second diagnosis to ensure that before they take that to the patient, it is accurate.
I think there's a crack in right here because um, uh, as a kidney patient, what I found as a dialysis patient, like a lot of diagnostics there are false alert.
Mm-hmm.
That's what I found because everything they told me, it was a false alert. My own nephrologist would tell me, like, no, my dialysis doctor, my nephrologist, they used to come at the clinic, see me every time, like, no, that's not possible. I don't know why is the hospital saying that. They're just delaying the process. And he was very sure that, that's not the case. You don't have any, oh, you have bumps in your, chest. That's probably breast cancer. And then they want you to do that specific test that's only offered in like very rare, like one or two hospitals in the entire town. And the wait time is too long, that delays the process more. So like these false alerts delayed my transplant at least 1 year, 100%.
Mm.
So during that 1 year of false diagnostics, I would say, uh, my health could be a lot better. Dialysis eventually causes a lot of other problems like eyesight. Dialysis has a very long-term side effects of uh, eyesight problem. Like I'm going through right now, I have eye pressure. So I think that could be prevented.
Mm-hmm.
And during UCLA was doing my transplant. So it's always they have to be, before they tell the patient about something, they have to make sure they have to watch everything. But they were just like, they were just what I felt they're delaying my I felt like they didn't want to do my transplant. That's what I felt.
That
And
leads
then
me to an
after,
interesting question really quick, Walid. Sorry to interrupt you, but when you're going through that, and I think that insurance is probably a really high, I mean, we know what has kind of happened out in the community with insurances and violence is never the answer. But unfortunately it did come to that. And how did insurance play into these false diagnoses? Like, did you have issues with any pre-authorizations or authorizations for payments in general? Did it ever stall it? Was it, it sounds like it could even be the other way where if you have these diagnoses that are false, they're actually paying for care that maybe isn't needed. So kind of tell me a little bit about that experience. And then I will actually pivot to Marc to also ask the exact same two questions.
sure. So my insurance, luckily, they never had a problem, especially the agent that was working with me, the caseworker. She was actually extremely nice and she was always down with help with everything. The only time I had problem with the insurance was when I signed up for the chimerism program trial, where they take the kidney and bone marrow from the same patient. Still in it's in trial stages. So my insurance is straight directly rejected that, denied it. And they said it's an experiment and we don't pay for the experiments. So that way I had to go with the second option. So my insurance, my private insurance was actually working with me, everything, and they were step by step next to me, shoulder by shoulder. So I'm always thankful to them.
That's good. That's good. That's a great I would say that's a great testimony for them. So it's quite often you hear the opposite. So that is really good to hear. And I'm happy that you had that. Marc, the questions for you are the same as posed to Walid. I wanted to know if during your care, whether, you know, your transitions of care, what challenges you faced during those transitions, or what kind of cracks in care did you experience during those transitions? And then secondarily, was there issues with the insurance and any authorizations? And you're on mute, Marc, just so you know. There you go.
Thank you. You know, it's really interesting because when I first got on the transplant wait list, during the duration of getting on dialysis to now going into the transplant world, they told me straight 8 to 10 years because you're an O blood type. So if you don't get a living kidney donor, your average wait time is 8 to 10 years. I mean, to understand that the magnitude of sitting on for 8 to 10 years, and that's even if I survive, me personally, if I don't know, but if I were to survive that long, can my body take in that 8 to 10 years? A lot of patients have done it. But I needed to figure a way to get also listed at different transplant centers, if that makes any sense, right? So what I did was then started to research where the time might be a little bit less than California itself, to the 8 to 10. So I started listing at different centers: Arizona, Baltimore, Maryland, New York, Florida, down to Texas, and go right back around. Now, here's the thing about multi-listing, right? When I'm going through that full process is, number one, you got to consider having a flight that is, it's called a standby flight. You have to have funding for staying there 4 to 8 weeks so that you're cleared to go back to your home state and deal with your nephrologist there. And how am I going to eat? So it's a full thing that's going on, right? I'm just very thankful it happened here in the state of California, in my hometown. And you know, and thank you. Shout out to UCLA Health for really making that transition of getting a transplant a success. But that whole thing, you got to understand and realize that when you do start doing multi-listing as an O positive, as an O, just an O blood type, period, the flights you got to consider, the hotels, the food, the rental, if you are going to be placed in that place, in that area, and also who's going to be that caregiver to be with you for the 4 to 6 weeks, right? Because you need that. Are they able to take 4 to 6 weeks off while you recover and get through that transplant? Insurance. And because I started listing at multiple centers, there's something called ESRD for Medicare that I was able to qualify for, that got me to be able to be listed at all these different centers where the transition was smooth. They just asked me what kind of insurances that I had. Medicare then kicked in and they said, you're approved. I got the golden ticket to multi-list. Does that make sense? So that was also something that my social worker did help me with, is getting on that so that I can then also multi-list, which I didn't know was possible at the time and in the beginning processes of my journey.
That's great. Thank you so much,
Of
Michael.
course.
I'm going to kick it back to you.
Thanks, Veronica. And just, I don't know if anybody saw our session last Saturday. We had Dr. Yasser Kazi, and many of you on the call know Dr. Yasser Kazi. But you know, kind of hearing your story there, Walid, he pointed out something as far as the education, and I think a big crack, which again, the theme of the whole entire series, is the actual proper workup towards transplant. And, you know, the importance of seeing the primary, and the primary kind of driving that ship to make sure that you got things like cardiac clearance, the cancer screenings, all of those things in advance. Because when you get to the transplant center, in his words, you know, I asked him, I said, you know, if every patient was worked up properly before you get there, you know, what would your role look like? And it's like, I'd be getting it through the hoops so every day. So that's one of the missing pieces of education, is that when we get to the point where we want to go on the transplant list, we are looking at living donation, proper workup is critical to the timeline. And as you both expressed, the timeline on a modality like hemodialysis specifically can be quite tolling. You know, days on the machine are years of life, right? Because of the aggressiveness and, you know, the high efficiency of the modality itself, the in-center specifically. So, you know, kind of segue right into my question, you know, you guys have been talking about education. You guys have been talking about the gap in communication. Let's go back before the diagnoses. And I'm not sure if any of you, I think all of you have kind of expressed it was kind of a slow roll, or sorry, a fast roll into kidney failure. Anybody get any education before you got to that point, before you needed dialysis? Any sort of and I hate to use the term ESRD, right? Pre-ESRD or pre-CKD5 education to say, this is what you're going to expect. Marc, you talked about the insurance, you know, that's a whole nightmare in itself. Like, you know, you start stacking up bills, right? Before you realize that there's actually entitled coverage through Medicare. So anybody get any of that pre-education? And if not, do you think that is a valuable piece to kind of the role that you guys had of a quicker roll into kidney failure? And then think about those that have like the slow roll, the chronic progression from type 2 diabetes or high blood pressure. Do you think that education is valuable? Do you see it among the people that you have sat down in the chairs next to, or those as you build your communities and are helping people to become empowered? Are you hearing that they have a workup? Are you hearing that they have the education they need to actually go into these renal replacement therapies with a working knowledge? Johny.
Me personally, I wasn't worked up with no education. I was just told you're going to get dialysis 3 days a week. Here's why. We got to clean out your blood. At the same time, I still have kidney function. So I did really have no education. I saw my nephrologist probably once or twice a month, and I couldn't ask what was going on. I had to like send him an email. Maybe 2-3 days later, I'll get an answer back, and I had to change that situation real quick because I needed answers. And it's, you know, it's when you're thrown to something like that, it seems like your whole world is shut. From working, family time, you're thinking about everything. So I had to educate myself and look into it and understand what chronic kidney disease entail of and what dialysis entail of. So with that, I was able to maintain a good, healthy diet. Now I'm down to 2 days a week on dialysis. So
Oh, wow.
It's been working out, but the education part needs to be there. Even when you're starting out, like I go on vacation, I go to a different clinic. They'll give you a booklet and tell you to read this. Here's an emergency procedure if something happens. There's really no like interaction as much as it should be, as much as you know, Michael, coming from a refinery background. It's like safety culture is very strong.
Yeah.
So
Yeah, I met Walid a little over a year ago, or sorry, Johny a little over a year ago, and you know, I learned that he had a refinery background, health and safety, which they wear a red hat and they kind of make sure that everybody's communicating, and I mean it's a built-in behavior of the refinery, so that must have been a sharp contrast to, you know, something safety as an occupation. And then safety and quality as a means of quality and quantity of life. It must have been a sharp contrast for you. I can imagine the aggravation because it's so built into the behaviors and the culture of a refinery worker. Justin,
Yes. So
for any workup, you mentioned that you'd had some issues when you were a young child. Were you prepared for what was coming? Were you educated? Were you empowered by the team that was working with you from that childhood to the point where you actually had the kidney failure?
I want to say yes. So everyone that did tell me before, I'll be like, yes, they told me. But when like life goes on and youth's on your side, sometimes you kind of forget. And I don't know if it's just me and I'm being biased, but kidney failure has been on the rise. I feel like in the past like 5 to 10 years, there has been a movement of trying to express what kidney failure and dialysis really is. I think for the longest time, we were getting fed kind of the cancer awareness for so long, and a lot of these cancer awareness, cancer funding thing was huge. And I think they kind of neglected that there's other sicknesses out there that people can get genetically. And so yeah, in a way I did get information and education about my kidneys, but the thing is like I said, like it happened at such a young age where you kind of forget about it. And I was kind of not really doing my checkups like I should have been, like my yearly checkups, which is a big part on my fault. I think now with like technology growing, TikTok and all these social medias that really do, help with advertising all this stuff. I mean, even Veronica's app here, like this is something I've never seen before as well. So, I think right now we're on like a flipping here on kidney failure and pretty much just any health sickness, because I think we're doing a lot better on sharing our stories with being able to share on all these platforms. And even just this webinar here, it's like, this is, we're able to kind of tell people so many sides of the story. And the education side is really hard because I feel like, it's a lot. Number two, sometimes it can be boring if it doesn't apply to you. So a lot of times it goes one ear and out the other ear when it doesn't apply to you. So that's kind of why, sometimes maybe making it easier for people to be educated on kidney failure would be great. I think that's some of the next steps that we have to do and find a better way of kind of explaining it to the next generation.
I love what you said, Justin.
That's really
and
powerful.
I'm gonna like hone in on the word our. And I just really appreciate the role that all of you play in sharing stories. Justin, I just I want to plug your social. You actually educate a lot of people. I mean, that's been my job over the last 25 years to educate people, but you're reaching millions of people with your story socially. So I want to give a chance for people to kind of check you out on your platforms. Can you go ahead and tell us how to get a hold of you?
Yeah, so my TikTok is Platinum Kidney, and my most of my videos, pretty much all my videos, will be on TikTok. I have an Instagram and Facebook, but I really don't keep up with it. TikTok is going to be my main platform that I use to spread awareness.
Yeah, you had a really cool video, or I should say a really telling video, just, I don't know, maybe a week ago. How many people did you reach with that video?
Well, I mean, it's pretty crazy, even myself. I got like 11.8 million views on that video, which is the most I've ever got before, with like 4,000 or 5,000 comments, 40,000 saves, many shares too.
Yeah, that's incredible. I want to turn it over to Veronica and kind of segue on that question.
Yeah, no worries. So I had a question really quickly that goes away a little bit from the subject, but really keeps it in tune. Goes back to Johny. One of the questions I had for you, Johny, was you said, you were never in this world and you weren't provided the education. And you seem like a very smart gentleman and you speak the English language. For the group here, what do you feel, if any, is the disparity for maybe someone who doesn't speak the language, who has never been in healthcare, and then doesn't have anyone to be able to advocate for them? I think that is there a barrier there, something you guys have encountered? And what do you think is a solution for that? I think especially we have such a diverse group here, that we can all speak to something of that nature that has occurred, because I think Justin was talking about the technology piece where, yes, we do have the technology, but I will say that one of the biggest clashes right now is like healthcare and technology don't always merge, right? We are slow to adapt in the healthcare community. And I can say proudly because I've been in the healthcare community for a long time. And sometimes it is scary when you're a provider to integrate technology. And so I think that's a two-folded question and open for the entire group to, are there certain patients that get even less accommodation or education than others? And then secondarily, what is that, is there a technological solution that can be had to be able to spread that mass education, even if it's not in someone's, if English isn't their first language, because I think that a lot of our healthcare entities are primarily English.
Yeah, so language barrier is always going to be an issue. During my clinicals, even at my clinic, English is the first language, but it's not the first language. It's usually Hispanics or Thai or Vietnamese. So what my clinic I get dialyzed at have gone to, they have a pad that can translate what the dietitian or the social worker is asking the clients, and they could read it, or it speaks out to the patients. That way they could communicate that way. And I dealt with it firsthand. The demographic of working in East LA was mainly Hispanic, and I'm not fluent in Hispanic. I could understand it, but it's certain things that is very
In
difficult.
Spanish.
So, yeah,
Yeah.
Spanish.
Yeah,
So,
that's okay. Everybody does it.
so I have to take the time to go ask one of my coworkers to come translate, and that delays the patient care. And
Yeah.
I don't want to do that. So currently I'm taking some classes to learn to
No, I do
understand more
know it's not a
Spanish.
plug for any other technology, but there's like apps and things you can download on your phone now that just does that automated translation. I don't know if those are helpful. It looks like
Right.
that some of the facilities have it on like their iPads. That's great to hear, because sometimes we know it's out there, but being able to stop the day to day to integrate something new can sometimes, it takes thinking outside the box.
That's a good question, Veronica. And
Yeah.
we got a lot of dialysis people in the chat. Just curious what you guys are using. I mean, they got the roll arounds in most of the clinics I've been in where you can actually get like a telehealth translator. It does take a few minutes, but it's pretty readily available for most languages. But anybody working with the technology to actually provide translation services through like a tele or any other, maybe, I don't know, maybe an AI or anything like this. I know there's overseas tellies, all sort of stuff going on. Please drop it in the chat. Go ahead, Veronica.
I will go back to our original stance that we were doing. I'll start with Johny this time. How did the missing information, we've just talked about just bringing it back together. We talked about the things that were missing along your journey and some of the education that you didn't have. And maybe, obviously, hindsight is always 20/20. So maybe you found it out later. There might even be, I think that, even in these conversations, you might notice like, oh my gosh, I didn't even know about that. And how come Justin had it and I didn't? How do you feel that missing information impacted your care or your decision making for what was like the next step in your journey?
It impacted my care because it affected me after they found out what was going on, like high phosphorus, low creatinine. All that was like done during my lab, and it wasn't communicated properly to me. So every time I do a lab now, I look it up, see what my trend is, and try to get answered and mitigate it or get it to a stable level. But that was mainly my main issue, was that I found out like after it was already done. So
Right. Marc, can you speak to how how that affected your choices, having that missing information or your decision making?
Okay, I'm so sorry. Can you repeat that last question?
Yeah, of course.
I'm
That's okay.
listening to Johnny, and I'm like, wow, this is, you know.
That's all right. So it is based on, the care, like that total continuum of care. How did missing information impact your care or your decision making? And you're looking at the hindsight when you're going, oh my gosh, I didn't know about that educational piece that I missed or some form of missing information. How did it impact your care or your decision making throughout your journey?
It would set me back, and then I would have to walk again. When I thought that I was on top of my health, my game, I would be set back by information that comes from another angle that I wasn't prepared for to ask, right?
Mm-hmm.
And I was diagnosed as an adult, as in my 20s. So for me, being diagnosed with not having too much medical too much medical background, and I know you were going on the story about how do we get that information out so that people can understand a little bit more. Um, I just did a conversation recently, and it was about how do we get better communication with the people. But I think people are more receptive when they can look at someone that looks like them to give the information to them. Because number one,
Mm-hmm.
they understand the language, they understand the struggle, they understand what happens at home. Because culturally, we tend to have we have similar backgrounds of what we do on the back end from what everybody else does, right? So just getting that information where uh, I can look at someone and say, you know exactly what I eat. You know that I'm gonna eat rice after this, and it's gonna bring my carb intake's gonna be way too high. I'm gonna eat some, fish or beans or whatever the case is. They know what we eat, so they're like, look, lay low off of certain things where I don't have to really share that as much, right? And I think that's where the lack of communication is, because that barrier is only because they don't understand our culture, right? I think it's a cultural understanding of knowing that, look, for me, I'm Filipino or I'm Hispanic. Like, I needed to talk to someone who understands that cultural understanding, because everything else doesn't make sense to me. Like eating certain things. Well, what can I eat that's culturally inclined with what I know how to eat? Because hypothetically speaking, my mother, my wife, my sister only know how to cook a certain thing, right?
Mm-hmm.
And if you can show us how to stop the salt intake or stop the rice and maybe make it into like like a little, like a hand or not a full spoon, then cool. Just help me understand that, because going into that, I don't know the difference of a good diet or bad diet till I was like 6 months out, right? Like, man, I'm itching way too much. I'm eating way too much salt. With me, when I was on dialysis, my fluid went to my lungs. So I know I needed to stay away from water as much as I could and stay away from salt as much as I could. I learned that very, very quickly and early on.
So what I hear you're saying, Marc, to just sum that up so that everybody has that full understanding, is
Of
it's
course.
really about meeting the patient where they're at, regardless of
100%.
cultural beliefs or cultural upbringing or anything like that, right? Because you could even have someone who maybe is the culture that is in that community, because every single community is different, right? You're going to have all these different. I mean, we're America, we're a melting pot, and so it has to be. It's even zip codes will differ as to what education needs to be there. So it's about meeting that patient where they're at and providing the education that is needed. Because maybe you run into also, I think that a lot now with the younger generation is they don't cook, right? So like, what can they do when you're like, no, we don't cook? Maybe they may not necessarily eat bad, but maybe they don't actually cook meals at home. So what are the choices that they can make? Because they live such a much different, faster lifestyle, especially if they're commuting from San Francisco to Oakland every single day. They're not cooking at home, right? They're
Right.
eating somewhere along the way. There's a lot of families who, or I would say patients who are no longer part of that big family. I would say the genetically involved family, right? It's more of they're a family within that community that they live in, but they're a single person themselves. And so
Right.
really meeting that patient where they're at is what I'm hearing you say would be the biggest change that could happen.
100%. 100%.
Great. So I'm going to pose a question for each of you, and we'll just start with Justin and then go around the circle here. I want to know that if you could go back what is one myth or a misconception that you had that you wish you could have really corrected early on that maybe would have been either life-changing, therapy-changing, or just, had that movement forward? What is one of those myths that, looking back, that you wish could have been changed along your journey, Justin?
Yeah, that's a good question. That's kind of always changing in my mind. I think, man, yeah, it's really hard to think what I would change. I think a lot of things I would have changed. I mean, are you asking like before I had kidney failure?
Either way, like, maybe it's at the kidney failure stage when you finally
Mm,
found out that you were having to be a patient. I think that before that, if you're like, oh, it was just a diet change, that would have been different.
mm,
Sometimes it's genetic, and we know that now, where they used to be, oh, it's just everybody who's obese is going to have this, right? We know that's not true. There's a lot of genetics that are played into it now.
mm.
So I would say along your illness journey, where did that come in?
Yeah, I would have changed, I think, just being organized with my health in general. I think for one, my diet could have been a lot better. Even if I knew I had kidney failure or like had a end stage one, two, three, or four, I think the renal diet would have helped me. And I think if I would have changed my diets before then, I would have been maybe able to pause it, maybe stop it. I'm not really sure. I know there's a lot of discoveries with kidney failure in the last couple of years, especially with AI and all these technologies and all the young people coming out. But I think I would have changed my diet. And even now I see online the renal diet is always changing, and they're always figuring out new things what can help the kidney, what can, kind of damage the kidneys. And also it's all personal too. It's all catered to each and every other person. Everything's not the same, especially when it comes to the potassium, sodium intakes. Everything could be different. But I think overall, I think the diet is one of the most important parts. And a lot of the times, I feel like people kind of get discouraged thinking that they can't help their kidneys, even if they get it genetically. But I feel like there's always things that you can do to help with your kidneys in your body. So I think it's just a lot about just information and just listening to the right people, and really just trying to figure out what works best for you. I think that for me, that's the only thing I would have changed is my diet and just listening and reading the right information.
Great, thank you very much. Walid, the same question to you.
Yeah, that's actually a very tough question. And when I think about it,
Almost feels
uh,
like a regret, right?
Yeah.
That you got to talk about.
no, I've been thinking like if there was anything that I could change. Actually, the kidney issue that I had, it was a genetic disease. I was born with it, and there was nothing that could have stopped that. Even if I had the best diet or the best lifestyle, as I was a fighter and I was so strict on my diet. I was eating very healthy food, training 5 to 6 days a week.
Mhm.
So there's regarding my health, I don't have anything that I could regret or go back and like I wish I could change that because the kidney failures, it was something that was going to come to me. That's what my doctors told me. It's one of the very rare diseases. It's called Alport syndrome. So there was nothing to stop it.
Mhm.
There's no way to reverse it. So, uh, and as you asked this question, as Justin was talking and answering, I was trying to think if there was anything that I could go and change it.
Well, and
And I,
maybe, Walid, the misconception for you is that people think, oh, you didn't have a control of your diet, and you always have to correct. Like, no, it was hereditary. It's genetically
yeah,
involved.
so that
So that's
was,
it.
yeah, if people, a lot of people like, oh, maybe you're
If you're a fighter,
a
steroids,
fighter,
right?
so you're probably taking. That was the first question they asked me when I was hospitalized. Did you take any steroids? I was like, no. So a lot of other people, like in our community, like, oh, probably you were taking too much protein, protein shakes. Maybe you stressed out your kidneys, you worked out. Oh, maybe you have been punched there, you know. So those were the misconceptions that people were having about my kidney failure. But actually, in actual life and in real time, none of them were true. It was just kidney failure. It was a genetic disease. Nothing could have stopped it. And
Mhm.
I think out of 100% patients that are like out of 100%, only 2% kidney failures are from genetic diseases. The other 86% are from, as we learned in Mike's school, 86% patients are diagnosed with kidney failure because of their bad diet, their diabetes type 2. But 2%, they're born with it, unfortunately. So I'm unfortunately from those 2%. So nothing could have stopped my kidney failure. And the people, everyone, they had the misconception, maybe I've been punched, maybe I've worked out too much, maybe I was dehydrating my kidneys or too much protein, steroids. So those were the misconceptions people had on my kidney failure, but none of them were true. That was just a bad luck.
Okay. Thank you. I appreciate that. Or good luck, right? I mean, you did get a transplant, so it could you gotta, count your blessings and
Yeah.
as they come along the way. And now you get to be here providing a lot of other people. So I'm sure you have definitely a life-changing testimony for others. And so maybe that was why it was given to you, because you're strong enough to carry it, right? We're looking at that.
Yeah.
Yeah.
Yeah,
All right, I'll
that's
go to
true.
Marc with the same question. Marc, the question is what's a myth or misconception that you wish you could have corrected, or that you could have corrected early on when you look back at the starts of your treatments or of your journey, of your healthcare journey?
Right. I have almost identical to Walid, right? Was the protein, my coach, I would get tired when I boxed, and I didn't understand why. And we're only in amateurs. We're doing 3 threes, right? Which means 3 rounds off, and then you do it's 3 2-minute rounds. I'm sorry, and then with a certain break. And I was just starting to get tired, and I didn't realize. And my doctor, you're probably getting punched too much into the kidneys. I was cutting weight. I was fighting at 118 pounds. There were a lot of that creatine, like Red Bull, but in all actuality, FSGS is a rare disease that wasn't my mother or my father didn't have this DNA thing in them, right? So the misconception was that, and then I what was interesting was with me and kidney disease is that I started to have foam in my urine, and I thought that was just protein leaking out, right? Like from the shakes, but that was actually protein that I couldn't hold in my body, which started to scar my kidneys a lot more, if that makes any sense, right? So I was like, does anybody have when they urinate, is it foamy? Like, when I would explain, it looks like like tap from a beer, right? That foam on top. And they were like, no. And I just thought it was me. And I just kept playing mind tricks with myself until I went into that hospital, right? Because the misconception is you don't look sick as well. Like, the labs don't say that. The labs are saying my labs are going down. So that was the misconception with me, was the weight with protein shakes and cutting weight to fight.
Great. Thank you. I appreciate that. I will go to Johny. It looks like it's Johny. You there? There we go.
Yes. So I could concur with both Marc and Walid. Just my follow-up with lab, not making appointments. I wish I would have just kept on making these appointments, understanding what the labs meant, understanding what these appointments entail. But like I said, I was healthy at 130, got sick. I was down to 97 pounds and still think I was fine, still doing the things I was doing. But from outside looking in, I was like, yeah, I was getting sick, but I don't feel like I was getting sick. So I wish I would have just stuck with the program, what my care team was telling me to do, and just listen to them. A lot of people don't go to get their teeth cleaned out or get their labs done or get an annual checkup. It's very important that people need to do that and follow, because you need to know what your body is intel of. So that's pretty much for me.
Very, very true. Thank you all for your honest and candid answers. Michael, I'm going to pivot over to you.
Yeah, thanks. And I think it's going to segue a little bit, but this is, everybody's journey is very personal. And I'm old enough to know that I don't know anything. the older I get, the less I feel like I know, to be honest with you. When I think about growing up and the culture that was instilled, the education or the perception towards how to go about staying healthy, whether I go to the doctor annually, when I go to the doctor aside from an annual visit, if I go to an annual visit. Again, all I know is I know nothing, because as I see other people's journey, my lens starts to change, right? And I just want to say, I really appreciate everybody who joined, who's joining in tonight, both on Zoom and socially. But again, the older I get, the more people I talk to, and the more open my mind becomes. But I'm just curious from all of you, personal beliefs, culture, emotion that are learned, or in some cases, fears and phobias. How has that upbringing, how has the core values that you have, the core emotions, the core approaches to life affected how you approach your care today, or how you've approached it through your journey, and how your lens is being crafted today? Are you listening to people like I am, or are you sticking to those core emotions, those core values? Marc.
I was trying to think about that, but okay, perfect. I've in this journey, vulnerability became my biggest strength. And I can also totally admit that when I came in here, I knew nothing, and I'm constantly learning. I'm trying to constantly understand my body, my mental understanding. I went through there's a thing called the 5 stages of emotion: denial, anger, bargaining, depression, and acceptance. And through those stages, you learn so much about yourself to inspire and tell the story to others, right? I'm always open to learning new stuff. This is what keeps me ahead of my own health. This is what keeps me ahead of sharing to other people, to try to being a credible messenger and saying, this is what's happening now. This is what's going on, right? We all come from, we all are going to the same path, which is trying to get better health. But in order to get there, we need to get the information and understanding of what's really going on, right? I've always been a person of learning. As an athlete, our goal is to keep continuously learning, because there's going to be vulnerabilities, especially when something new comes up. Someone's going to be able to see, and this is now into the boxing term, is that somebody's going to be able to see a vulnerable side and can get that, right? I just want to be open-minded to listening to what, again, to the fight point, is what my coaches in my corner, that the people that I put around me have to tell me, so I can always just better myself, right? Like Walid going through the immunosuppressants at 0.5 milligrams. As a patient myself now, I take 15 medications a day, 105 a week, 420 a month, 5,040 pills a year, just so my kidneys don't reject. I know what I'm taking in my body. And that's because I was always asking questions to the doctors. What is this? What are the signs and symptoms that I got to learn from this? So it's always a constant learning, a learning curve in every moment of life that we go through, right? Especially in the kidneys, in the health space, when you're fighting for your life.
Walid, any personal beliefs, emotions, experiences, fears, phobias that led to the way that you interact with the team, the way you approach your treatment, your care today?
Actually, day by day, as you guys both said, my life, I actually accept this. This is a learning process. Every day I learn something new. At the beginning, when I signed up for something, or the dialysis, when I started dialysis, as Justin said, he didn't know what dialysis is. So it was the same thing for me. I had no idea what dialysis is, what they do. If you Google, even if you have a small disease and you Google it, you'll end up getting like, oh, you're gonna die.
Google MD.
That's WebMD, right?
Yeah. So those are like, it's always better to know the right person, asking the right questions, and educating yourself. So I never had that idea like, no, I'm always right. I had enough knowledge and that's enough for me. No, it's always better to go out and keep learning and learning and learning. And right now I have signed up for this chimerism tile. And I before signing up to this, I did a lot of research on it. And day by day, every day, I'm learning more and more and more about this, how it's been working for other patients. That kind of boosts my confidence. So I always keep learning and always keep asking questions, and I ask questions to the people that have the right knowledge. So that's what I've been going and doing right now. So um, yeah, so just going and going and going, and it's working great for me. S- and now I'm actually amazed how Mark is taking all of those pills. That
Mm.
could be me, but I've taken a big risk, and the patients that who have done before me, there most of them are actually it's been 5 years, more than 5 years, they're not taking any medicines at all, and their kidneys, everything is working properly without any problem. And some of the I'm not saying I'm not trying to scare Mark, but some of the immunosuppressives are really actually they are damaging the kidneys directly.
I know, brother.
And
I know.
yeah,
You're my hero,
so
man. You're my hero, man. My day's to one day be like you when I grow up.
so especially tacrolimus, I'm taking that's everything is a challenge. Tacrolimus when you're on immunosuppressives, you're actually more vulnerable for cancer, skin cancer. You can't be in the sun and there's a lot of other risks. Everything comes with the risk, and dialysis has its own fight. Kidney transplant patients have their own fights. So it's always a process. Learn, 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 and keep yourself healthy.
Justin.
Yeah, how I view kidney failure for me lately is I kind of just see it as like a fight. I see it as like a battle for me, and that kind of helps me keep on going through all this. There's a lot of times where there I have bad days and good days, and usually the bad days I can always just kind of try to make sure it doesn't last longer than a day. And I think, and with everything, even lately, this past couple of years, even meeting you and all you guys has been helping me fight this battle too. Because when I see people that are dealing with it, because at first, I knew I wasn't alone, but when you first go on dialysis, you kind of feel alone some reason. I mean, maybe it's because you don't really talk to as many people in the very beginning. You don't know yet, and then like Walid said, you Google it, it says you're gonna die. So it's like you get in there and you're just like, well, what the hell? Like 5 years is the average life of a dialysis patient, so a lot of stuff is going through your head. And luckily for us, it's like with the internet, you're able to kind of talk to so many people, and there are people on dialysis for 10, 15 years, or maybe even longer. I've seen 20 years. And so, my fight becomes a lot easier when I just communicate and talk to other people. And
Yeah.
so that to me is the strongest way to battle this journey, is just to communicate and be able to just talk to other people that are experiencing it and even longer. So that's usually what I had to do to keep going, is to just talk to you guys and just talk to people that are dealing with it.
On to you, Johnny.
Well, for myself, it was mainly understanding the disease. I went through the whole thing of being depressed, sitting in the chair for 3.5 hours, just just feeling miserable, feeling sorry for myself, where I could have died, but someone else wanted me to stay on Earth. So I just took that and ran with it and started communicating with other patients that's been there longer, going through their journey. There's a lot of stories you hear in the clinic that is just uplifting. Some could be negative at times, and it kind of bums you out, but that's just life. But just being transparent with your care team, with my care team, was a big part of it, because I didn't know and what I was getting into, and by doing the research. And at that time, my primary care really didn't know. She referred me to UCLA. So now they have a great communication link. So that was the main thing. Communication is, and understanding and education is just my main thing to just keep on going on.
Thanks, guys. Hey, I just want to kind of go off of the outline here, Veronica, and I'm gonna throw a question in here. We just got another panelist on named Jeff Park, and as I said a few minutes ago, you know, the older I get, the more I know I don't know anything, and I just want to say that everybody on this call, including Jeff, have really molded the way I think about things, because I grew up with kidney failure of a loved one. I saw I had a very jaded view because he was at home, and you know, he was really a strong male role model. He was kind of Superman to me. And I'll be honest, I didn't really realize how much he was going through growing up, because he was really able to hide that from me as a child, and then from a lot of the people that were around him. He was just this guy who, he did a lot of things, and one of them was dialysis. But you know, Jeff, you've really helped me to see it, take a new lens towards what's going on in this world. So I'm curious to you as well, Jeff. You know, you've got a long experience. Maybe you could introduce yourself, tell us a little bit about the journey, and same question to you. How has the personal values, views, fears, phobias, experiences that you've had over the years uh, molded how you approach your treatment, how you interact with healthcare teams today? Welcome to the webinar, Jeff.
Hey, thanks. Make sure you can hear me okay?
We can hear you great.
All right. Hey, thanks, Mike. Yeah, first and foremost, everyone here on the call, I want to apologize. I was initially scheduled to be part of the panel, but some things personal got in the way, and it kind of sidetracked me from being a full-time panelist here. But to answer your question, I think I've been on dialysis for almost 30 years now, minus two failed transplants. And, you know, I've seen the system change and evolve in ways that I may not personally agree with. And I know I'm one of the more opinionated and vocal people on LinkedIn. And I think that's helped me actually shape my journey in a more altruistic manner so I can understand other people's perspectives. I think when I first went on dialysis way back in late 1990, the internet really wasn't there. So education, information was totally not available. You were left to communicate with those you may have met in the clinic, nurses, nephrologists, social workers, etc. And over the years, you begin to kind of shape your own opinion and your beliefs about how the system should be. And, you know, that can be good, that can be bad. But I think generally overall, what has helped me adapt is understanding that you need to always speak up for yourself. You need to advocate very clearly, very vocally for yourself. There's never a one size fits all approach to anything, specifically dialysis or even transplant. We all know that there's a lot of inequities, there's a lot of issues with the systems, both with dialysis and with transplant. But when you start to learn to speak up, challenge the status quo, I think you will learn that you will find better ways to adapt, better ways to take care of yourself, better ways to manage the disease, because that's the one thing we all need to keep in mind is we cannot let this illness manage us. We need to manage it. We need to be in control of the dialysis, control of our diets, control of our medication, control on how just we approach life in general. And I think if we let that go to the side, an air of anger, desperation, hopelessness, you're gonna tank. And I want to speak also to social media. While it is a very great tool to have, I think we also need to be very, very cautious of the information that we get on it.
Mm.
You know, LinkedIn for me has been very professional. Michael, you and I have communicated throughout the years, and
Yes.
we share the real information that's been, researched and cited. But when you go on sites maybe like TikTok, you're gonna really risk getting misled with information about diet, about what you should and shouldn't do on dialysis, what you should and shouldn't do post-transplant. So just in a nutshell, I think it is that we all need to just look at it from our own individual perspective and then reach out and kind of branch out to others and educate each other, get each other's perspectives. Um, but again, as you all know, maybe some of you know me, some of you don't, but I'm not very happy with the way, the large dialysis organizations treat care. And I think we need to do a better job as a community to change that.
Thank you, Jeff. And just, if you don't know Jeff and you are on LinkedIn, I really suggest you kind of take a look at what kind of information he's putting out and how he's sharing his story. There was also a recent CBS documentary that came out that Jeff played a major role in kind of highlighting the state of dialysis as it is today. And I'll say, there's the good, the bad, and there's some very ugly in the world today in all areas of life. And I just appreciate you, Jeff, for having the courage to speak up. You and I, we don't always align on everything, and we've got the productive conflict to where I know that I've learned a lot, and I think a lot of other people have as well. So keep up the strong
Yeah,
advocacy, brother.
thank you.
Veronica.
All right. Thank you so much, Jeff. It's wonderful to meet you. I do follow you on LinkedIn. So I've read some of your stories, and Michael has told me a great deal of good things about you. So thank you so much for being here. I appreciate you. So I'm going to give this out to everybody. I think I'll, we'll go around the journey again and ask if you could give advice to healthcare providers about how to better support patients like yourselves. What would it be? You give me 1 to 3 things. If you can only think of one, that's okay too. And I will start with Walid.
I'm so sorry. Can you repeat the question?
Sure, no worries. So the question is, if you could give advice to healthcare providers about how to better support patients like yourself, what would that be? And you can name 1 to 3 things.
So the first thing I will say is always push patients to get full treatment. So a lot of health professionals, especially in dialysis technicians, I've noticed when the patient wants to cut the treatment, they're like, oh, okay, there you go. But I always suggest them to, push patients to get full treatment out there, depending on from what I think every dialysis session only filters blood like between 5 to 15% comparing to actual kidneys. So they actually need to get full treatment. So that's one of the very first thing. And the second thing I'll say is for especially for social workers and dietitians, when they speak to patients in regard to their diets and all that, uh, I would say if they could do a research on what patients, as Marc was saying, how they know what they eat. So basically, all their diet plans are based on American food. If they go back into where the patient is from, how they eat, what they eat, and if they could make a diet plan based on their own food, so that would be a lot easier for patients to be able to take care of their health. So these are the only 2 main things that came up to my mind.
Thank you so much, Walid. Justin, I'll ask you the same question. The question is, what advice would you give your healthcare providers about how better to support patients like you?
Let's see. I think I think it really it's really based by I'm trying to think here what would be a good one, because it's so hard because I'm trying to think of so many things. I'm thinking about my clinic too, what they could do to help me, and a lot of it is just it's a case by case, is just learning how to read people. I think a part of being in the clinics and being part of hemo or PD, it's really learning your people skills. And I think that there are times where if they could read me a little bit better, or if I have concerns, or sometimes it's not always to be by the book, and a lot of stuff is kind of outdated in my opinion. And even what Jeff is saying is like there's so much new stuff going on. There's a lot of technology being in the process of even artificial kidneys and all these things. And a lot of times it would be nice for the clinics and the workers to kind of really be update with that. And I think it'd be cool to see just updated answers for everything. I think that always excites me too, especially when I get my monthly doctor visit and he's trying to tell me news that he's heard of, or even when the Dr. Kazi podcast, and he's talking about transplants and what are the new technologies that's are being in the works and all these things. And so for me, it's always just having the clinics and the people just be up to date, and also talking about the new technology that are always forming around kidney failure, just like how they treat like cancer. There's always a new article every week talking about they've cured cancer. So if I have if these people can have the same energy towards kidney failure, I think that would really help me and all the patients feel like we're actually trying. And just information, and just having the clinics be just more in tune with the new updated information that's out there.
Great, thank you. And I will move over to Marc. You're on mute, Marc.
Yeah, I'm sorry. Can you repeat that? I'm listening to
That's okay, yeah. If you
Justin
could
and
give,
Walid. I'm like,
no worries. If you could give advice to healthcare providers about how to better support patients like you, what would it be?
let me sit at the table, not be discussed at the table. Period. I'm having so many.
Involvement with your care.
I'm sorry.
Involvement with your care.
100%. 100%. You guys go through a team. Let me be in that team while you guys are talking about it. I think that misconception of, well, you might not understand. Well, help me understand. Because at the end of the day, I only see you for 15 minutes. As a matter of fact, I'm always on the call with your assistant to put me on the list, to put me on the time to get me to see you longer than I am to see you. Does that make sense? So I'm on the phone more with the assistant to schedule me for seeing the doctor than actually seeing the doctor for the time period. Does that make sense?
Mm-hmm.
I just want to stay on top of my game. Just be on top of it. I know Walid and myself, we come from an athletic background, and always staying at top peak performance is just keeping us in the loop. That's what I would say.
Thank you. That's really powerful. Johny?
I agree with everything that was been said. For me, I would say listening and have everyone involved, especially family members or potential caretakers. You could talk to the patients and tell them you need to change this for their diet, but how are you going to verify that they're doing that? They leave the clinic. You don't know if they're going to tell their significant other or whoever's preparing their food what diet to change. So I think it's just like a verification of what's been told and communication with the family, which is part of their care team. Because you could come in and get a glucose test that's in range, but your A1C is through the roof. So you can't hide that. So I think just more involvement and like a checklist verification, like anything. There's in dialysis clinic, there's verifications for testing the waters. There's logs for cleanliness and disinfecting. So that's for me.
Thank you, Johny. I appreciate that. Jeff, would you like to give some input to that question also?
You're on mute, Jeff.
Sorry. I think we need to see less fragmented care. We need to see more involvement with primary care physicians, nephrologists, social workers, dietitians, and I think we need to see less of checkbox care. We need to have better discussions. We need to be able to disseminate better information. And I think as the gentleman before me mentioned, involving care partners is absolutely critical, especially if you're on home dialysis. They face a lot of challenges that a lot of people may not be aware of, and we need to be able to support those individuals as well. And I think as a care team, we need to start addressing that as well. So I think there's just a lot of disjointed care that needs to be addressed in this industry. And I think we need to get more point of care, um, you know, integrated into each of our care plans.
Thank you. I appreciate that, Jeff. Michael, I'm going to give it over to you. It looks like we have 15 minutes left. So I know we took a little longer on some of them for our agenda, but I definitely want to be able to have this Q&A with the great people that also joined us from the outside
Yeah.
who are panelists. So give it
I
to you.
want to kind of give a ending thought to that last question. And just as I hear kind of let me be at the table, not, part of a discussion that I'm not a part of it. And I always say to the students that I teach that, what's your team, right? Oh, I like the Lakers, I like the Clippers, whatever it is. But, the individuals on this call, like if I think about myself as a healthcare professional, that's my team. You know what I mean? And the whole win is for that person, not for the team that's playing the game. It's if it's the Lakers, the win is for the Lakers. If I'm on a team for somebody that I'm participating in their care, that's who I play for. And the strongest voice should absolutely be the person that I'm playing for, the person that I'm performing for, the person the reason why I wake up early in the morning, 1:30 in the morning or 2 in the morning to get at the clinic and open it up and do all these tests and things like this. It's for one person at a time. And I can't help but think about some of the scenarios or some of the situations I've ran into with patients that are sharing emotion, that are sharing concern, that are, advocating for themselves. And for one reason or another, the rest of the team wants to shut their eyes and ears to what they're saying. Sometimes they can't take it. Sometimes emotion comes out in a way that is, not me as the technician or, Joe as the nurse can't really take it. And we kind of put up this wall of, that's a difficult patient because they're sticking up for themselves. They're asking the questions that maybe I don't have the answers for right off the tip of my tongue. So, I just like to throw into all the people that are listening, especially those that are professionals. My experience is, you should not be throwing walls up to patients or to people that are asking you difficult questions, that are holding you accountable, that are asking for patient-centric care, to personalization, to put yourself in my shoes type of performance. So I just wanted to add that on, that I think, as far as a way that we can improve or a way that we should approaching care is to really, like you said, Marc, put the patient front and center at the table of directing and providing the input that's needed, that's for their well-being. Self-management, not compliance, right? Self-management, not compliance. If they got the education, if we're educating them properly and giving them all the tools, they go home after dialysis. They're living in between the treatments. They're the ones that are going to really win the game. We got a very short time as healthcare professionals that we spend with the patients, although it's, a thrice weekly cadence. It's not much time with them. So really appreciate everything that you all have said here. I want to open it up first. Anybody who has questions, please start to drop questions in the chat. But I want to open it up to the panel here. Hearing each other's stories. Justin, who's currently doing peritoneal dialysis. Johny, who shared that he's doing in-center hemodialysis. Jeff, can you share what modality you're currently undergoing?
I'm doing home hemo right now.
Home hemodialysis. Walid, who had a living donor and then also a bone marrow donor, and Marc, who had a living kidney donor as well. Do you guys have questions for each other after hearing each other's stories and what you've the differences, the similarities, the common themes, etc. Do you guys have questions for each other? And I'll open it up to the panel.
Let's go, Marc.
You want me to talk? I was going to wait for everybody else, but 100%, I'll definitely go on. Look, guys, I just want to just share with you guys, man. I am inspired every day by what you guys do. You wake up every day to fight a battle that we've gone through, we're going through, and to see you guys always strive to get and get for that better day. I really admire your guys' strength. Sometimes I need inspiration, and I always look to you guys when I'm on social media, because a lot of the times we do end up getting back into that dark place. But it's people like you guys that create that community. You know, when I first met you guys, and this tends to happen with a lot of patients, it feels like we've known each other for such a long time, based on the struggle that we go through. Wow, you can look at me and say, "How's your day going?" And I'm gonna be all right. And you know exactly where to pinpoint where that pain is coming from. And if it wasn't for this community, I don't know where I would be. I only have that strength because it's people like you who've always uplifted me. And there were times where, and I can admit this now, looking back, is that I wanted to quit. But what I would have been doing is failing and turning my back on the people who said you can do it. To the people who said, you know what, I believe you can get through this. So I didn't give up. So when you guys share your story and you guys are giving your input, just know that we need that hope sometimes, because you know our story, you know our struggle. And it's empowering to see that. Community is an acronym of common in unity. And that common in unity is just wanting peace through the hell that we go through every day. I know what that 3 hours is like. I do. I know what it's like to also get a transplant. Jeff, you know, God forbid, I don't know what going through a failed kidney is, but you have a lot of experience. I've watched a lot of your stuff. And I just want to thank you guys for that. Right? Us as a community, we know what it's like. And we're letting people in now to see what our shoes is like and what it's like to walk in them. So thank you guys for sharing the inspiration of hope today, in hopes that it gives the people who are listening an understanding of what we go through daily.
Thanks, Marc. Panelists, any questions for each other? Audience, any questions for any of the panelists? Hopefully you've looked them up by now, and you can find your way into each other's community. But any questions? Now's the time to drop them.
I think there was a good question here for Rodney. It said, what are things that can improve your in-center dialysis experience that would make you look forward to coming to treatment 3 days a week? It looks like Justin posted an answer there. I don't know if we want to start off with that one from this participant.
Justin, can you speak to the reply there?
Oh yeah. I answered one of them. I just saw it pop in one of the questions, and this is all personal opinion, really. I know a lot of people have different stories with hemo and stuff like that. And I was only really in hemo for 6 months, so I wasn't really that long. But one of the only things I could take from it, from a tech standpoint, is just setting the energy. I think a lot of people don't want to be there, so I get it. It's a hard thing to kind of make it exciting. I mean, you're going to be hooked up to a machine and draining your blood and then putting it back in after it's filtered. That's not really a fun, exciting thing. But the only positive thing I can look for is having fun and high energy techs. And again, I mean, even that's hard to always be positive at work at all times. That's nearly impossible. But whenever I saw some of my techs that I really liked, that kind of made my day a little bit better. So for a tech that's questioning, what can they do to make it better? And I think just be more personable and have more fun. And, some of the youthful people there are kind of always a little scared, because most of the older people there, the average ERCD patient is 60 something years old. So like, if you're someone like me that's like 29, 30, when you get in there, it's like a little scary. And then, a lot of the older people already kind of look defeated. They look dead already almost sometimes, so I think that's one of the things I can, give advice, is just try to have high energy, set the tone, and maybe someone will have a better day from that.
Thanks, Justin. Jeff, do you have any question for any of the gentlemen or the young lady on the as the moderator?
I personally don't. I think I would like to speak to the to Justin. I think that was you that was just speaking. The energy in the clinic, even though I don't do it in center now, I did do it for 20 some years. And I know that the techs are overburdened. I know the nurses are, overburdened. There's a lot of understaffing in the clinics, and it shows when you get the rush care. But I think if the techs, the nurses, social workers all kind of just realize that, the human element still needs to be addressed. And I think we all need to see we're all people, we're all individuals, and that we're there for a reason, whether you're a patient or whether you're staff. But I know it's challenging for techs and for the nurses, they're running around handing out medications, or, they're dealing with other patients, other emergencies in the clinic. But I think when we start to feel the energy from the techs and the positive energy, you're right, I think we'll have a much better experience.
Very much appreciated.
I have a question for here, because it's something that we don't quite dive into, but I think it goes along side by side in my my bachelor's is in psychology, and I was a director in a psychiatric hospital, so it's very near and dear to my heart. But what is the mental health side effects or overall effects or things that happen with this? I think that a couple of times, I heard Johny talk about he just sat in there and he wanted to die. Are we talking about the way in which this messes with the psyche, and are we talking about the depression that might come from these morbidities and just that overall helplessness? And then what avenues have you been given to get help? Or is it simply, we focus so much on the body, but are we focusing on the mind and soul when you're going through this? I would love to hear from your guys' experience, what is working either really great or maybe it's lacking in that overall total care as you're going through this.
I could take up all your time with that question. I think the mental
I'll give you
health.
2 minutes, Jeff.
Yeah, sorry. The mental health aspect is completely missing. Depression, I think, is almost like 80% of patients on dialysis. And so we're not addressing that at all. We're not giving the proper assessments. We're not giving the whole patient care that we need. So I think that's something we need to start building into our care plans.
Anybody else take a stab at that?
Actually, that's a good question. So when it comes to mental health, kidney failure with me, actually at the beginning, I was getting depressed, like, God, why me? I had a healthy lifestyle. I was not drinking, I'm not smoking, and then still I got kidney failure. But at one point I was like, you know what? Let's just accept it. Let's just accept it. It's a part of my life. I have to survive. I have to go get treatment. That's the only changes I'm having. Out of my full schedule, I just have to give 4 or 5 hours every other day to my health. So that kind of reduced the mental pressure on me. So it's a suggestion: if you're on dialysis, just accept it as a part of your life. Never let dialysis stop you from growing up. Just keep on moving.
That's a great sentiment, Walid, and it's something that I witnessed personally in my life with the family member that I grew up with. Again, I think I had a jaded view that everybody can do that, and when I entered into the profession, sometimes it's doable for a while. Sometimes it's just like life, outside of kidney failure, where you've got your good days and your bad days, right? And I know there are days where even today I wake up and I'm just, I'm a bear to everybody around me. And there's other days where I'm super high energy, and there are days where I actually crack a smile, right? I think understanding that from the technician, from the nurse, from the care partner side, that every day is different, and kind of going back to not holding grudges, you know, give your love despite the mood, despite the mental status of the person that you're caring for. Give your all, give your love. Don't hold a grudge. Don't hold them to the good, the bad, or the ugly. Just, you know, give them love every single day. And that can be challenging as well, as we talk about the mental toll on people going through the kidney disease itself. To Jeff's point of, you know, kind of the workload, you know, why do people want to do this job, go into this profession as a dialysis tech, as a nurse, as a doctor? I think everybody in you know, in the infancy of wanting to do these things is because they want to help people. And very quickly, sometimes over years, when we look at the throughput, when we look at the rush, when we look at the short staffing, when we look at livelihood, it starts to become, as I kind of let my tongue slip, a job. And the mental toll it goes both ways. I think there are a lot of people providing care that have that go through depression, that go through putting up walls, that become apathetic, and you know, you're not going to be doing a good job for people if you're falling into those circumstances either. So I think both sides, you know, there's a need for attention towards mental health, towards emotion, towards the toll of kidney disease on everybody around the person who's actually going through it: care partners, care providers. So guys, we're at time. We definitely won't shut down, but I just want to speak to those who were here for the continuing education unit portion of it. Thanks for sticking through and hearing these great stories. I know you're going to walk away enriched from what you've learned here. Hopefully your perspective on care is being molded. And want to thank you, Veronica, so much for the support through the continuing education series, herewith for what you guys do in both elder care, but as you cross over to providing solutions, personalized solutions, really, for people to take the care to the place that is most comfortable in many occasions, is into the home. So I'm going to let you close us out on the CE, and then we'll keep the webinar open for just kind of a catch up and a good night from everybody. Take it away,
Thank
Veronica.
you very much, Michael. I appreciate you. And again, thank you guys for being so vulnerable, sharing your stories. I know it's not easy, especially to the masses that are watching and listening. So I think this is really powerful for a lot of people. So again, thank you very much. And thank you for having me. Please check out Herewith. It is something that I do believe will change the way the future of care, especially in-home care, works, because I do believe that the future of care is at home. That is where we are all most comfortable. Work has pivoted towards home. There's so many things that most people don't leave their houses for anymore, right? Our house is where we're most comfortable. And it is amazing for people who have even something as serious as dialysis can still live a quality life. And I think that is something that Herewith is prepared to enhance, not only enhance, but push forward for so many different modalities, for so many different patients of every single age continuum of adults. So keep us in mind when you guys are thinking of things that are truly groundbreaking and technologically advancing, because Herewith is definitely here to stay, and it's going to be an amazing look back to see where the company is in 50 years. So thank you again for having me, and anything that you need from me, I'm always available. And again, thank you so much, Michael. It's really been an amazing and pleasurable journey to get to know you, and then again to get to know, Marc, Jeff, just for the little bit there, but I have been reading your stuff on LinkedIn. Johnny, Justin, and Walid, the best to all of you, and God bless.
Thank you.
I just want to point out last
Thank
comment
you.
in the chat. Jeff brought up a great piece of advice, and for those of you who have not heard of it, Maslow's hierarchy of needs help as a navigator in this system. So true. That goes for, I think, any system. Looking at the people in the system and Maslow's hierarchy of needs is really, really important stuff. So look it up. If you don't know what it is, look at the pyramid, look at what the foundation looks like, and look at what the the top of that pyramid looks like. I think it'll be really beneficial to your life and to your career and the way that you think about care. All right, for those of you with CE, thanks again, everybody. If any of the panelists want to stick around and just chop it up a little bit, Melissa, we can probably stop the recording at this point and stop the live stream as well. And then we'll, guys, thank you so much for jumping on. As always, and I hope you know the sincerity that you guys are my inspiration. I mean, meeting you guys and many of the people who are online, it's who I am today. And I don't have kidney failure, but it's become really the sole theme and purpose of my life for 3 decades. And I can say in the last few years, I've shared this with some of you that maybe the last 5 years, that I've become very dissatisfied with this profession that I've had for 3 decades, in a way that it keeps me up at night. And I think about you guys. I think about the people that I follow their stories, and hearing those stories in a way that, like I said, all I know is I don't know anything, but I really want to be in another area of healthcare, which I've done today. I finally, found a spot for me that is not so focused and so satisfied in sitting people in dialysis chairs. I really would love to, when it is possible, to help people find ways to stay healthy, prevent, delay progression. And the way I see dialysis today, that I would hope that everybody, if they have to get to that bridge, that it is a bridge into transplant, as 2 of you young men have experienced. And I'm looking forward to everybody else on this call that is fighting kidney failure, crossing that bridge as well, or finding the level of personalized care that, as one of you said, that it's not the only thing you do. It's one of the things you do. I think about my uncle every day, and when he would talk about himself, he'd be like, I'm Greg, and I build hot rods, and I like to volunteer at my kid's school. Like, he's there like every week, right, doing volunteering and stuff like this. And he was like a strong male role model. And you'd never hear anything about dialysis until like way, way late in the game. And again, that would be my hope for people, that if they're stuck on the bridge, that it's bearable, that it's personalized enough, that it's doing good for them. Love what you said, Jeff. One size fits all, cookie cutter, not gonna cut it, and it's not cutting it. So again, I just want to thank you guys sincerely. This really meant a lot to me, besides putting on a webinar that could get such a group together. I don't know if you remember when you guys met on the podcast and the art show. Those are like moments that I'm gonna die with a smile on my face, thinking about, people coming together that can actually help each other. And I know that some of you have supported each other through some tough times, some midnight phone calls, stuff like that. I hope this family grows, and that you guys, that it extends beyond, the first 2, and then it multiplies to 4, and then to 8, and that, we've got new friends. Marc introduced me to some new friends that are fighting some battles. Been meeting with him regularly over the last couple of weeks. So I think, we can only do what we can do, right? And I'm happy that you guys are doing what you do.